Welcome to Heart-Based Medicine's Insights podcast. Featuring Bence Ganti, MA, integrally orientated clinical psychologist and director of the Integral European Conferences. What is heart-based medicine?
Yeah, I think that the medical profession has left out the heart, in modernity, in the 20th century. And probably medical profession in the ancient times were more holistic, where the doctor participated with his heart and spirit as well. So we have to bring that back, but we are not just repeating ancient times, but we need to reinvent the new times that are calling now, that somehow the relational dimension, kindness, being there with a present heart and attention to the client must be there in the medical profession. And I think there is hardly any patient in the world who would not want the doctor to pay deep and personal attention to him and her. So we have to bring that into the medical profession.
How do we create a shift towards a heart-based medicine approach?
Yeah, so we have to train the doctors, because it's not by chance that the heart is left out. The current paradigm is that we are rational beings governed by physical processes and protocols, and we just have to fulfill those, and that's our duty to the client. No, we have to bring in the relational aspect as well, and for that we have to train the doctors. We have to create trainings, institutions that combine the interior world, the relational world, with the exterior physical process-driven world that the medical science is focused on. So we need an integral approach, basically, where the interiors and exteriors are equally taken into account, and that's what probably healing is all about.
Do medical practitioners suffer from a poor connection with their internal psycho-spiritual selves?
Exactly. From their own internal landscape, they are separated. There is a high suicide rate among physicians, around 50% or something like I heard. That's actually the burnout rate. But also the suicide rate is very high because they themselves are separated from their internal psychospiritual world and processes, and they are also separated from the client's internal psychospiritual world. And this all needs to be reconnected, and we need to learn how to do that.
What are systemic resistances to a heart-based medicine approach?
Yeah, there are different doctors because there are different stages of consciousness. So if a doctor carries a rational modern mindset, that doctor might have resistance to all this what we say, and might actually be aware not to interfere with any personal interiors. But if the doctor is a bit of a step ahead and has a postmodern approach, where the doctor in his own life discovered interiors and emotions and psychology and spirituality, then within that doctor there would be a need and openness to get ready for a heart-based medicine. I think there are a lot of doctors out there that are stuck in the medical system, but who would be ready to make the next step if there's an initiative like this. Well, I think there's a lot to begin with, and the doctors are just afraid because the system shuts them down. But internally, a lot of doctors are already dreaming about a better profession.
Where should heart-based training begin?
I would say we can start with anyone who is interested. Of course, students would be the best to bring this into the university training, but why not? Already practicing adults and doctors could learn that.
What heart-based successes have you witnessed?
What I see as a psychotherapist, and when I'm saying psychotherapy, I'm saying not only working with clinically mentally ill people. I'm more interested in normal people who has internal issues and want to grow towards the higher human potentials, because there's a lot. So working with normal people with their interiors as a psychologist, as a psychotherapist, I see that once we open the heart towards the client, once we are there with our full attention and presence for someone, then all kinds of dynamics starts to happen. So the other person might be very enthusiastic that we are paying full attention, but also, previous stuff, hidden stuff in the personality might jump up and come into the relationship. Repressed fear, repressed sadness, repressed anger from the childhood will come out if we start to love the client. That means that the doctors also have to learn to deal with psychodynamics if they want to start to heal from the heart. So this is my proposal to the heart-based medicine, that we need to give a doctors a certain amount of psychotherapeutic wisdom in terms of how to handle relationship when two people are really connected in a healing relationship. And also healing has to do with spirituality. So it's not just physical technical processes, and spirituality happens and can happen also in the relationship. Spirituality is not just something happening in your Zen Zafu when you are sitting 1 hour at night, that's personal meditation. That's when you empty your mind and open your heart and the deeper spiritual aspect of your being. But then you have to bring it to the relationship. And doctors have to bring it to the doctor-client relationship. And then actually in that relationship, besides the physical healing, that needs to be there, of course, we don't want to deny that, but we want to extend that with the psycho-spiritual healing in the relationship to make it complete and holistic.
How do medical professionals become more heart-based?
Yeah, I think for the doctor in the training there has to be experiential. For the client, if a client comes to see a heart-based medical doctor, for the client it doesn't have to be anything extra, rather than the doctor is now paying attention to the client, talking more, not just 8-11 minutes visits with technical questions, but spending maybe 20 minutes, 30 minutes with the client, and talks about also how he feels, how he thinks, and lets a creative interaction happen with a caring heart between him and the client. So if people are in real relationships, they are really there, not just playing the roles, then something creative happens there. You see? It's not just protocols. Something creative happens in the relationship. Two people together in this can have insights. They might even have creative insights about the nature of the illness or the cause of the illness. So we can bring this aspect of a healing relationship to the medical profession. Borrow that from the world of the psychotherapist.
How does the physician-client relationship change?
Yes, imagine that you have high fever, and the family doctor visits you and checks your fever and blood pressure and prescribes a couple of pills and stays there with you for another 15-20 minutes and has a very honest conversation, skipping all the formalities that we usually have in small talks, and asks real life questions. And then you feel like, okay, here's the doctor I trust. You start really to open up and speak honestly, almost like confession to the priest, but without religion. Speak out your heart. That in itself might be healing, and that in itself might be healing, might give you relief, and might even bring up stuff that are related to the cause of the disease. So healing conversations, healing relationships are very welcomed in the medical profession.
Is this a one-size-fits-all approach?
Clients always seek, in psychology, clients seek a psychologist, a psychotherapist, or a trainer who they can trust. Yeah, so there's a subjective element in it. But what I notice, I also train a lot of psychologists to be therapists, that everybody has their own personality. Somebody is colder, warmer, more introvert, more extrovert. But somehow, those people who are resonant with that character will find that doctor. You see? So it's not that we have to make one scheme for everyone, We just need to encourage the doctors to be themselves and to tap into their deeper authentic self. You see? The deeper authentic self there, will draw in those clients who can trust that doctor. And we should give freedom to clients to choose their doctors, not just mechanistically, list them to certain doctors.
This has been a Heart-Based Medicine production. Thanks for listening.